Hi dear friends, I am Dr. Rahul Bhargava, Director of Hematology and Bone Marrow Transplant. I am a hematologist and a blood cancer specialist. As we know, there are red blood cells, red white cells and platelets in the bone marrow which are being produced in bone marrow, which is a hollow space between the bone. And these cells are produced in a regulated manner that 100 cells are formed and 100 cells die. But one fine day, these 400 cells are formed and only 50 cells die. So they get accumulated in the bone marrow and decreases the red blood cells, by which we feel weak. You decreases the platelet, you have bleeding spots over the body, and this is a starting point for blood cancers. And as we know, there's a plethora of investigations, plethora of technology and scientific discoveries which are happening on a second to second basis, not week or months, second to second basis. Similarly, that has led to a better understanding of blood cancer. So blood cancer is a conglomeration of many diseases. That means leukemia, in which the white blood cells are being formed aggressively, which is called acute leukemia, which is of two types, AML and ALL. You will not remember anything, don't worry. There's a chronic type, CML and CLL, where there's an oral medication, and in CLL, you do not require treatment. I'm saying you do not require treatment. Okay? Then there is lymphoma, which is a problem of the lymph nodes, where the white blood cells are being used as the soldiers to fight against infection, and they have become immortal, and that's why this lymph nodes grows, which is in the neck region or in the axillary region. So that means if you have got any of those lymph nodes, you can contact on the given numbers below, which is scrolling in your front of you, so that you can ask those questions, relevant questions, so as to get cured, because there's a lack of information in today's world, and this is the platform which is giving you the information at this present moment of time. After that comes myelodysplastic syndrome, where the cells are not being formed properly. There aplastic anemia, the bone marrow has got shut. Then there is multiple myeloma, where the plasma cells have started eating the bone marrow, any other thing, and leads to the pathological fractures. So that's multiple myeloma. Or anemia and unexplained renal failure, where the renal kidneys have shut down. And any person who gets a renal shutdown at the age of beyond 50 years of age, think multiple myeloma. That's how think and do and act upon it. So these are the plethora of problems which are getting accumulated under the name of blood cancer, which tends to bring in fear to you. And our job as a hematologist is to reach to you and tell you, need not be afraid. Do not get fearful about bone marrow and the blood cancers, because the science, the government, the doctors are working together to beat blood cancer. If you have got any questions, any suggestions, anything which you want to ask for your own relatives, your neighbors, to help us in beating blood cancers, you can contact us on these given numbers. Thank you.